Welcome. My name is Mark Gurevich, and it's a pleasure to welcome you to our Department of Population Health's 4th Annual Health and Conference.
Today is a conversation that's focused on a topic that we are all very committed to, but coming from different directions. In this work, we really wanted to begin to understand how potentially the stress of a mother can alter how that connectional diagram begins to be formed before birth. And so using non-invasive MRI technology, what we did is we performed scans on 118 human fetuses. And so what this work suggests is that patterns that underlie common neurological and psychiatric disorders may already be present and disrupted by the stress of the mother during her pregnancy.
I believe when we're talking about breaking the cycle of intergenerational poverty, it really is that exposure. Kids don't know what it is that they can be if they've never seen it. This idea for the Magnolia Mothers Trust really came about a couple of years ago, which is our guaranteed income pilot, where we are providing 20 low-income African-American mothers $1,000 a month to utilize however they see fit, really trusting that they are the authors of their own lives, that they have agency, and that they know better than anyone what it is that they need for themselves and their families to be successful.
Parent Corps is an enhancement to pre-K programs. It has 3 components. At the heart is a program for parents. There's a program for children in the classroom, and importantly, there's a program for teachers and program leaders. Today I was truly inspired by Chancellor Carranza. To hear him speak about his efforts for equity and excellence in the way that he did, and gives me tremendous hope and optimism about our scaling Parent Corps in the future. We are dependent on the system and the system's investment in families and in young children and in racial equity.
How do we engage and work with families such that we're meeting their basic needs, such that the content from the intervention that their kids are learning, they're also benefiting from. But then it doesn't stop there, right? What are we doing to address the dearth, if you will, of fresh fruits and groceries in some impoverished neighborhoods? What kind of impact does that have on families? Or the mom or father who is struggling to find employment, and that sort of economic stress impinging upon the well-being of the family. What are we doing about that?
We now know of over 1,000 synthetic chemicals commonly used in the environment that can scramble the body's natural molecular signals or hormones and thereby contribute to disease and disability. Unfortunately, children from low-income and racial and ethnic minority neighborhoods have disproportionate exposures to these chemicals, and that contributes a substantial part to disparities in health.
People say to me all the time, what do children need? Children need everything for as long as they need it, and they need it at high quality. The reason that the Harlem Children's Zone works is because there's really not a plan B out there. Being in the community and building community, engaging community is one of the things that we're the proudest of. You have to give families and children and community what they really need to be successful, and then they can thrive and do extraordinary things.
What an incredibly rich day this has been. So thank you very, very much. And here's to closing out Health and for 2019.